Welcome to the Brain Body Exercise presentation of the Bridge on the Gymnastic Ball Exercise. This video presentation is one of a series of videos that provide detailed instruction in exercise and movement techniques. We call them Brain Body Exercise because we recognize that in all movement the most important factor is learning to precisely control your muscles and joints. This control of muscles and joints is done through the brain and nervous system. Understand that everyone has a unique posture and body alignment. By doing the right exercises for your body in the correct manner, you will be caring for your muscles and joints over your lifetime. Not only will you train your muscles and joints, you will also improve the functioning of your brain in its other tasks such as vision, hearing, taste, smell, and balance. It will also help with cognitive tasks such as memory, solving problems, and making decisions. How this works is explained in more detail in our Principles of Brain Body Exercise video, so watch that video. The intent of these videos is to provide some backup information to my patients. They have been trained by me in these exercise techniques. If you are not a patient of mine, please make sure that you get adequate instruction with a trained professional. A doctor with extensive exercise training is preferred. Also observe all general contraindications to exercise that may apply to any medical problems you have. Your physician may help you know what is safe for you. One last important point. Every human being has a unique body structure. Therefore, you'll be best served by doing exercise movements that make your structure better, not worse. To know what exercises are right for you, you need a detailed structural and neurological analysis. The bridge on the gymnastic ball exercise gives you stability of the pelvic, abdominal, and lower back regions. It strengthens the buttocks, the sides of the buttocks, and the abdominal muscles. It helps with lower back pain. It challenges your balance, giving the brain a lot of input. This is great for brain-body coordination. Here is the starting position. The buttocks and lower back are moved off the ball just enough to allow them room to drop downwards without hitting the ball. The shoulders and head are on the ball. The arms are straight out from the center with the palms facing upward. The muscles between the shoulder blades are tightened. The feet are shoulder width apart and the knees are bent to 90 degrees. This is the correct starting and finishing position for the exercise. But now you need to know how to get into and out of that starting position, and this is what I'll show you next. Start out by sitting on the ball. Walk your feet out while you simultaneously lay your head backwards on the ball. When you want to get off the ball, walk your feet back up while you simultaneously sit up. You must lay back and sit up or you'll slide off the ball. Keep your feet moving and wear shoes with some grip on the bottom. Keep your arms out to the side throughout the movement and resist the temptation to put your hands on the ball or out to one side. You're teaching your abdominal core to balance you. You can start more slowly than you see here if you want. It might look difficult, but I've taught 80-plus-year-old people to do this, and it's worth the effort to learn it. After attaining the correct starting position, drop the pelvis straight downward. In doing so, let the low back arch. At the bottom of the movement, tilt the pelvis backwards before coming back up. This is the most difficult concept to get with this exercise. I'll show you a close-up of this movement shortly. Move upward, keeping the pelvis tilted backward and the low back flat. Squeeze the buttock muscles and the muscles on the sides of the upper thighs very hard at the top of the movement and hold for a few seconds. Lower the pelvis downward and begin again. Throughout the movement, keep the ball steady and the knees bent at 90 degrees to the floor. This is very important. Your only movements should be up and down, not backwards and forwards. This is a great buttock strengthening exercise if you move the pelvis straight up and down. Let's take a closer look at the tilt of the pelvis that occurs at the bottom of the movement. Doing this movement correctly, combined with the muscle squeeze at the top of the movement, will go a long way towards getting the kinks out of your lower back. Notice how at the bottom part of the movement the pelvis is tilted such that the lower back is flat. Make sure to watch our video on pelvic tilting to master this technique. Here are some important technique points to keep in mind with this exercise. Get into the correct starting position. Tilt the pelvis at the bottom of the movement. Squeeze the buttocks at the top. Keep the ball still. Should you have any questions, you can contact us by email or phone. We are here to help you.